Dr. Ann Halley-Tierney, thank you for joining us today and talking to us. As we visited before we started our interview, it just reminded me that even before I got into my 60s, I've always liked being around older people. I always learn from them. They have great stories. Some of the favorite stories I've done in television are about World War II veterans, but also just older people because of their experiences. Did some of that attract you into this field of geriatrics when you went through all of the pain and expense and time of medical school?
Oh, definitely. The reason I became a geriatrician was because of my grandfather, who actually was a World War II vet. And my grandmother took ill. At that point, I realized I wanted to go into healthcare at some point. I didn't know nursing, medicine, in order to help older adults. And then when she passed away, I got to see the effect a geriatrician could have on my grandfather. He decreased my grandfather's medication list from 22 to 8. All of a sudden, my grandfather became very active, vibrant, because of decreased medication effect.
Interesting. In your experience so far with your grandfather and with your patients, what do you know now or have confidence in now that you didn't know, let's say 10 years ago, or that doctors didn't know 10 and 20 years ago? What advances are we making to help senior adults deal with Alzheimer's, dementia, and other things we'll talk about? What's new in your field today?
I think one of the things, and speaking to my grandfather, is kind of a emerging idea of less can be more in geriatric care. One of the great things in medicine is that we're able to have cutting edge technologies and very new medications, but sometimes medications can add up, technologies can add up and actually cause more harm than good. And so I think there's an emerging thought process of really questioning different tests, really questioning new medications to see if they're actually going to have a beneficial effect.
So even with good physicians, with good intentions, you do think that we have over-medicated senior adults in many cases? I
think that's something that I see not infrequently, that people who are trying to treat a disease are doing it appropriately, but then when side effects happen, they use another medication to treat the side effect, as opposed to kind of taking a step back and seeing if we need to kind of pare down and just use the most essential medications.
Alzheimer's is something that you don't have to explain to people. It's one of those diseases, challenges that everyone knows about. It's talked about a lot. Most anyone who has older parents or older grandparents might experience it. Can you, without explaining what it is, because I think we know what it is, what are we doing today in 2017 when people are diagnosed with Alzheimer's that we weren't able to do or didn't know to do maybe a decade ago?
Well, one thing that I think that, and this is kind of exciting, is that people are recognizing it as something that is not a part of normal aging. I would say when I was in my training, people would just say, oh, mom's getting old, she's senile. And while some mild forgetfulness is part of normal aging, Alzheimer's is not normal, and people are beginning to realize that it is a disease separate from aging itself. So I don't necessarily have to explain that a lot to people. One thing I do have to explain is that Alzheimer's disease is a subset of dementia. A lot of times people say, she's got Alzheimer's, but that's okay, she doesn't have dementia. And I have to explain that Alzheimer's is under the dementia umbrella. Also, one thing that's less exciting is that we don't have many medications that can help you regain memory. We have medications that can stabilize memory, but they are just that, memory stabilizers. They're not going to bring back memory that you've lost.
You just mentioned a few moments ago about not over-medicating, but there are medications that can slow down the progression of Alzheimer's. Is that correct?
Yes, sir.
And used properly and appropriately, you're seeing good results from that?
With one of the classes, yes, and it depends on when somebody's diagnosed. If they're diagnosed early in the disease, the medications tend to be more efficacious, basically because they're stabilizing a higher level of memory. Unfortunately, if somebody comes and they have a very severe case of Alzheimer's, starting the medications aren't going to have as much effect.
Disregarding medications, some people will say, keep your mind active. Don't just sit around watching TV. Do crossword puzzles. Watch Jeopardy. Keep your mind active and keep being around people. Are those good guidelines too?
That is perfect. Actually, people ask me, what what do I need to not get Alzheimer's? And I say, you need to go back to being 20, and you need to eat a heart-healthy diet. You need to, what I say is physically active, mentally active, and socially active. Make sure that you're being healthy, because a lot of dementias are also compounded by cardiovascular events. Mentally active, I had one patient who hated doing crosswords, but he did them every day because that's how he was going to not get dementia. I said, just do something that you enjoy that uses your brain. Read, garden, knit, something like that that employs different parts of your brain. And being as socially active as you can with other groups, your church, any kind of group like that keeps your mind engaged. So that's pretty much the advice I give people to try to stave off dementia.
And you don't have to be good at crossword puzzles.
No.
Just do them.
Yeah.
Just try.
Exactly.
Keep your brain active. In reading, in preparing to talk to you, not only was Alzheimer's mentioned, but also delirium. Not something we hear much about. What is it? Is it pretty widespread in senior adults?
It can be, and the problem with delirium is it can be a very silent and bad actor. It's basically, what delirium is the definition is a fluctuation of consciousness based on something else. A good example is if somebody has to have a surgery and they have anesthesia and they come out of the surgery and people notice that they could be normal one moment and then very confused the next moment. So you have what's called a fluctuation of consciousness. Usually it's caused by something else, an infection, a surgery, a medication, pain, and it's treatable if you find the underlying cause. That's basically how you treat it.
Once you find the cause and realize, oh, that caused it, now we're going to deal with it, should it go away and stay away unless you have another traumatic event come up?
It should. It might take some time. And one of the things that people in hospitals try to do if they're keeping an eye to their elderly patients is trying to minimize the chance of delirium, because patients who get delirium after procedures in the long run tend to do more poorly than patients who don't get the delirium. But the way to treat it is to treat the underlying cause as opposed to giving somebody a medication to treat the symptoms.
Let's end our conversation by talking about the need for more smart young people who want to get into medicine to consider geriatric medicine. There aren't enough of you out here, are there?
This is true. We're kind of a rare breed. At the moment, as I was telling you before, in the state of Alabama, there are 60 geriatricians who are boarded. And they estimate that there's a need for about 200 in the state of Alabama. Those kind of discrepancies trend across the entire nation. Right now, we're looking at about a shortage of about 13,000 geriatricians nationwide.
I kind of jokingly said that, but if someone's interested in medicine, this is would appear to be an attractive field, a wide open field, and there's going to, as my generation, a little ahead of you, ages, there's going to be plenty of customers too.
Yes, and it's very exciting because right now, because there aren't as many geriatricians, we get to pretty much choose what we want to do, whether it's hospital care, outpatient care, teaching, nursing home care. It's a really exciting field. I might be biased, but...
Well, I don't blame you for being. I've had the same general practitioner for about 35 years now, but I'm going to add you to my doctor list. As I get older and older, I may need you to help me, okay? You've helped us a lot today just with your expertise and your time. Thank you, Dr. Holly Tierney, for sharing your time with us.
Oh, well, thanks for having me.